We are pleased to present our cancer overview and a spinal cancer personal reflection presented by Lori Nitschke, Melissa Cozy, Michael Lake, and Kevin Warnicki. With special thanks to Mike for her kindness in sharing and reliving her personal experiences. Cancer defined is the uncontrolled growth of abnormal cells anywhere in the body. Cancer develops when a body's normal control processes stop functioning. As these abnormal cells age, they do not die, but rather form new abnormal cells, which starts a cycle of uncontrollable growth. As these cells start to multiply, they may accumulate into a mass of tissue we call a tumor. However, a tumor is not necessarily a cancer, as the terms tumor and cancer are sometimes interchangeably used, which can be misleading. A threatening or cancerous tumor is termed a malignant tumor, and a non-cancerous tumor is termed a benign tumor. It is helpful to understand these distinctions clearly when discussing cancer diagnosis. Some cancers, like leukemia, do not form tumors, but rather flow within the bloodstream as mutated blood cells. There are over 200 types and strains of cancers. Cancer has no boundaries and can occur anywhere in the body. Breast cancer is the most common in women, while prostate cancer is for men. Lung cancer is the leading cause of cancer death in the United States, while breast cancer is the most prevalent.
At the simplest level, cancer or cancer cells are cells that have lost the ability to follow the normal control that the body exerts on all cells. In our body, we have billions and billions of cells, and they have different functions. It's a very complicated process under incredibly phenomenal control. And if something goes wrong and that control is lost and particular cells escape the normal control mechanisms and they continue to grow and they may spread, that's what we call cancer.
Those cells together, we would call that a tumor. Specifically, cancer is a malignant tumor, and we call it malignant because not only can it invade into adjacent organs, but unfortunately a cancer can spread to other tissues, and that can be life-threatening.
Cancer can actually occur anywhere in the body because there are cells everywhere in the body. In women, one of the most common cancers, of course, is breast cancer, and in men, prostate cancer. And in both men and women, lung cancer and colon cancer are common cancers.
It's important to understand that the cancer that occurs in one individual is very different than the cancer that occurs in another, just like those individuals are different. So a lung tumor in one person will be very different from a lung tumor in another person.
Once the diagnosis of cancer is made, of course, the next obvious question is, what do you do? There are several things that are really relevant. The stage of the cancer, which is information about where is the cancer. Do you say it's a particular kind of cancer? How much cancer is present? Has it spread? Is it in lymph nodes? Has it spread to other organs of the body?
Cancer type. Today, there are many people living with cancer or who have survived cancer. Shockingly, 1 in 2 men will develop a cancer, and 1 in 3 women will develop a cancer. There are 5 main categories of cancer. Carcinomas begin in the skin or tissues that line the internal organs. Sarcomas develop in the bone, cartilage, fat, muscle, or other connective tissues. Leukemia begins in the blood and bone marrow. Lymphomas start in the immune system. And central nervous system cancers develop in the brain and spinal cord. Cancer therapy. Oncology is the study and treatment of cancer and tumors. Oncologists use three main therapy options to treat cancer: surgery, chemotherapy, and radiation. Surgery is the method to extract the tumor. Chemotherapy uses a digestible chemical mix to kill the abnormal cells. Radiation uses a concentrated dose of X-rays into the body to kill the cancer. Treatment use will depend on the cancer type and its stage of progression. Treatment goals are to kill as many threatening cells while minimizing nearby normal cell damage. However, researchers are finding few individuals cancer cases identical, and these subtypes require different treatment approaches.
Cancer treatment often involves more than a disease cure alone. It is not just abating the tumor. It must also tackle the pain, fatigue, and associated depression that often accompanies the illness. Of the three treatment options discussed, chemotherapy and radiation are the most invasive, as it is tough on the body and challenging to the mind. Gastrointestinal symptoms are common therapy side effects to the body. A customized diet of nourishing foods and eating habits can mitigate these side effects and keep the body nutritionally fueled. Certain foods can help minimize nausea, diarrhea, or constipation that many cancer patients experience. Proper nutrition helps the patient keep their immune system strong, which allows for the continuous fighting and treatment of the cancer. Leveraging the powerful mind as a medicine tool can directly affect emotional, mental, social, and behavioral health factors. The mind plays a large part in all healing processes, and using its inner strength as a cancer coping resource will improve overall wellness. Using support groups, family counseling, relaxation imagery, positive laughter, and humor are just a few tools to empower the mind medicine tool to benefit total well-being. Although cancer treatment and prevention continues to evolve, it is a well-accepted fact that individual lifestyle choices directly influence chances of developing cancer. To reduce cancer risk significantly, consider these 7 simple lifestyle changes. Do not use any type of tobacco. Numerous forms of cancer are the result of smoking and chewing tobacco, including lung cancer, the #1 cause of cancer death. Eat a healthy diet of fruits, vegetables, whole grains, and beans. Avoid animal fat sources and refined sugars. A healthy diet full of plant sources limits your exposure to obesity. Maintain a healthy weight with physical activity and exercise. At least 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity per week achieves substantial health benefits. As a rule of thumb, include 30 minutes of physical activity into your daily routine. Shield yourself from the sun with hats and clothing, or use plenty of sunscreen. Avoid all sun lamps and tanning beds, as these are just as harmful as natural sunlight. Preventing certain viral infections, such as hepatitis B and human papillomavirus, also known as HPV, by immunization is important cancer prevention. Practicing safe sex by limiting partners and using condoms is effective in limiting sexually transmitted infections such as human immunodeficiency virus, also known as HIV or HPV. Avoiding needle sharing with other users will dramatically limit exposure to HIV, hepatitis B, and C. Administering self-exams and seeking professional cancer screenings on a regular basis will increase early cancer discovery. Discovering cancer early is critical, as it provides the greatest chance of treatment success.
Looking at these scans and
Smoking causes 16 different types of cancer.
probably talking 6 to 8
Ones that can kill you fast,
outside.
ones that can kill you slower, ones that can change how you see yourself.
See you later, eh? See you, son!
Ones that can leave you almost speechless. Ones that can take away life's most basic pleasures. There are 16 different types of cancer caused by smoking, and you have one clear way to reduce your risk.
Hi, my name is Mike Lake, and I wanted to tell you a little bit about the day that changed my life. Just like any other day, I was driving home from work. Next thing I knew, I had lost movement in my legs. Instead of running the red light through the intersection, a very busy intersection, I chose to steer into a light pole. I was taken by ambulance to the hospital, and within 2 hours later, I was in surgery. I woke up in the hospital bed in mesh panties, wondering what in the world had happened. 4 days later, while I was still in recovery at the hospital, I was diagnosed with lumbar spinal cancer. I think at that time I actually quite possibly would have had what we consider a mental breakdown. I threw everything that I could pick up that wasn't tied down, and was asking myself what I did to deserve this. If I hurt somebody, what not? Apparently this was not the first time doctors and nurses had seen this type of reaction, but it was the first time my mom had ever seen me behave like that. I had no idea what to expect. I was extremely scared and angry. Very, very angry. After my initial surgery and the shock wore off, my doctors and I met and decided that my best options were to combine chemotherapy and radiation or the additional treatments. Chemo, it uses medication to destroy the cancer cells, or at least to stop them from growing any further. The radiation was used to eliminate the remnants of the tumor that I had had removed and that had remained in after the surgery. The side effect of the combination of treatments was nothing shy of hell. The nausea, the vomiting, the diarrhea, fatigue, weakness, anemia, and just overall pain. There were nights that I physically couldn't get myself into bed, and times that I was so sick to my stomach I couldn't leave the bathroom. I had to have a garbage can in my arms, and tears were running down my face because I was so sick. I'm 5'11", and I dropped down to 117 pounds. At 23, this is pretty hard to take. And I made it through all of this just to be diagnosed again 5 years later. I had to go through the whole thing over again. Healing my mind and my body. Now 12 years later, I sit here wondering if being diagnosed with cancer was a curse or a blessing. I had to rebuild my physical strength because I lost almost all of my muscle. I now work out 5 days a week, and I do CrossFit Tuesdays and Thursdays. I love to cook, so I know what I put in my mouth. I eat lots of fruits and veggies and fish. I also keep a daily diary of food that I eat, and that monitors my portions too. I physically feel great. Mentally, it's been more of a challenge. I found throwing myself into work was a great distraction, but was not healing my mind or my resentment or my anger. I became more introverted and distanced myself from my friends and my family. took me almost 5 years to realize that I wasn't doing myself any favors. I started peeling off my layers that I had built up. I went to counseling. I started volunteering and started letting people back into my life. I have to say that I think that being diagnosed with cancer was a blessing. I was actually diagnosed for a reason. It's made me the person I am today. And I don't think I'd change that for the world. I wanted to share a picture that I had made and I hang on my wall. It's something I look at every day. This picture is my daily inspiration. And when I have a bad day or think of, I really am able to think about how blessed I am and that I actually I'm here to make a difference. I was given a second chance, and that's pretty special. Thank you.